CDC has warned this could be a particularly bad year for respiratory viruses, with flu, COVID, RSV all projected to be widely circulating this winter.
But a new survey suggests many Americans have let their guard down when it comes to common respiratory viruses. Our Dr. Frank McGeorge is here with a closer look at the results and the risk. Doc.
Yeah, I'm already seeing patients with all of those viruses in the ER, plus a fair amount of pneumonia as well. But health officials are concerned the biggest risk could actually be the apathy that many people are feeling toward taking precautions, including getting vaccinated.
When Joe James tested positive for COVID as a healthy 27-year-old, he wasn't too worried until
I woke up extremely short of breath and thought I need to go to the hospital.
Joe ended up on a ventilator and would spend 7 months in the hospital.
There was virtually no risk factor that he had to say, you're somebody who's going to get really sick if you get this, but it happened anyway.
As a pulmonologist, Dr. Megan Conroy has seen the toll that COVID, the flu, pneumonia, and RSV can have.
The best way to help prevent from this virus, any viruses, really upending your life, is to make sure that you get vaccinated against them.
A new national survey from Ohio State's Wexner Medical Center finds 35% of adults are unconcerned about the rise in respiratory illnesses, and a third believe they don't need vaccines if they're not at high risk. While 87% of respondents say they do everything they can to avoid spreading seasonal viruses, 1 in 3 don't believe their decision on whether or not to get vaccinated affects anyone else.
I think people like to think about their vaccine choices as only personal health choices, but it does impact the people around you, because it does impact the likelihood that you could spread an illness to them as well.
Getting a little vaccine pushed in your arm, or everything I went through, the vaccine would definitely be an easier choice.
Now, getting vaccinated reduces the risk of spreading those illnesses to the most vulnerable people, including babies, immunocompromised, and of course, the elderly.
Timely reminder, because Thanksgiving, you've told us many times before, that's the kind of kicks in the season, right? Because we're all together.
Absolutely. The holiday travel and gatherings basically take all of the circulating viruses, mush them all together, and spread them around. Yeah. I know that no one likes to be sick and that no one likes to miss things. Yeah. But if you are feeling ill, it is best for everyone if you stay home and you avoid getting everyone else sick as well.
Yep. Okay. Dr. McGeorge, thank you.